Welcome back to Awakened Exchanges. I'm your host, Jay Rich, and this is our third Thanksgiving episode for you. This whole month, I'm focusing on people who care for others, people that can show us how to be grateful all year round. We have an extra special Thanksgiving Day episode planned where I'll be speaking with Ayanna DeCosta of Vehicles for Change. We also have a Christmas Eve episode that I can't wait for, but first we're going to kick off our holiday podcast on December 3rd with a very fun conversation with the one and only Nick Hinton. He's about to publish his second book, and he's going to share some very provocative theories about our perception of the universe. I can't overstate how excited I am for him and our other December guests. I suppose that now is about the time you'd expect to hear me rant for a few minutes, but I'm not really sure what to talk about this week. I suppose since we're focusing on healthcare for this episode, I want to at least address the COVID nightmare that we're still enduring at this point. I'm personally dealing with my closest COVID brush yet, as one of my housemates is confined to their room and the upstairs bathroom, and I'm also quarantining myself as I await his test results. I didn't fully realize the difficulties involved with not being able to get groceries or share the kitchen. Finding him ways to keep his sanity while also enjoying some hot meals has been a challenge, but one that I'd rather face than taking a chance on exposing others. I'm feeling fine and didn't have much of a contact window with him, but his symptoms are progressing past the annoying and into the watchful stages. With any luck, it'll stay to just headaches, stuffy nose, and minor trouble breathing, instead of progressing along the worst path. Fortunately, we're both fairly young and active with few risk factors for complications, but it's still scary to see him running so low on energy right now. I just want to stress that this isn't a joking matter. COVID very well could feel like just a minor cold for you, and hopefully for my housemate, but it can take a serious turn for the worse. I recently heard about 3 family members that were still joking about COVID being a hoax right up until they died from it. While I can't find the paper to cite that, I can share the Fort Worth Star-Telegram's report of a 4-year-old boy who lost his dad in June. His dad was 33 and contracted it while training for a new job. And then, 4 months later, his mom, a 29-year-old, contracted COVID and passed as well. 2 young people are gone, and now this 4-year-old will never know his parents. I know that wearing a mask seems like a silly thing, but if there's any chance that it'll help even slow the spread of this virus until we can get the most vulnerable people in our society vaccinated, then it's worth the hassle. Both of the new vaccines require being kept frozen, and one of which needs to be kept at negative 70 degrees Celsius, which is not an easy thing to do for transport or storage, especially when you need hundreds of millions of doses. Let's get our healthcare workers vaccinated, then our elderly, and then we still have to hope that it's effective for long enough that we can tamp down this virus. Until we're closer to these goals, I don't think that wearing a mask is an unreasonable request. Europe is already turning the corner on their rise in infections for this second wave. And how did they do it? By locking things down again, restricting all of their citizens, and I know that Americans won't go for that. Maybe that means we should do some voluntary measures. We had over 180,000 new cases on Friday the 13th alone. We're still at more than 165,000 as I write this on the 16th. We were at 30,000 or so per day when everyone was freaked out back in April, but now it's not a big deal? Of course, we all want things to get back to normal, but does that mean you should care less about those around you? I definitely don't think so. Well, I apparently found my rant for this week, but now that that's said, I just want to thank Charlotte Ash for joining me this week. She was the executive director of the Snake River Community Clinic in Lewiston, Idaho for the last 20 years. Her clinic specializes in serving the uninsured and underinsured of Southwest Washington and Northwest Idaho. Despite her recent retirement, she agreed to step in this week and talk about her personal passion for helping others. She chose to devote the latter part of her career to helping those in need rather than expanding her pocketbook. We're extremely grateful to have her on the show today. Before we get to the interview, here's a brief rundown of our sponsors. First and foremost, I want to thank all of you personally for your support. Just listening to this podcast and sharing it with your friends gives me a reason to keep striving to provide the best content that I can. If you have the means and would like to contribute personally, please don't forget about our Patreon page. where you'll get access to exclusive content and deals just for our dedicated fans. There are already 2 bonus videos available there, and I'm planning on adding another in the next couple of weeks. As for the other sponsors, Awakened Vapes was the first of the Awakened brands and has been helping you modulate your high with CBD-only, high-terpene vape products since 2019. Genesis Pharms has been making the highest quality medicinal RSO, among many other amazing products, starting with the medical community back before 2010. And last but not least, the Caramel Corn Company, bringing you caramel corn the way it was meant to be. And remember, if you enjoy this podcast, please subscribe on YouTube, Spotify, or wherever you're listening. Also, please leave us a 5-star review on Apple Podcasts. I know that every podcast says it, but that's because it really does help spread the word and visibility. You can also support us on Patreon or connect with us on the social media of your choice. We are at Awakened Exchanges on Facebook and Instagram, and at Awaken Exchanges on Twitter. All right, now, stay tuned, and thank you for listening to Awakened Exchanges. Genesis Pharms was founded on the belief in cannabis's ability to heal. Genesis Pharms is more than a brand. They're a compassionate community of like-minded folks that generate top-quality cannabis products made with love and care. Community outreach is always on their mind, and their partnerships with Grow for Vets and Parents for Pot was just a beginning to what they hope to accomplish in the coming years. You can find their products on the best dispensary shelves across the state of Oregon. Their RSO is the most consistent quality in the state, their tinctures are second to none, and their personal massage oil will have you and your partner both coming back for more. Find them on Facebook, Instagram, and ask for them in your local dispensary today. Don't forget to listen to Sean's interview right here on Awakened Exchanges soon. Our new sponsor is the Caramel Corn Company. Caramel corn the way it was meant to be. Made from premium ingredients in small, handcrafted batches and completely gluten-free. The flavors include original, roasted cashew, salted almond, mixed nut, white morsel macadamia, spicy sriracha, peanut butter, butterscotch, and my personal favorites, raspberry caramel apple and chocolate drizzle. I can't say enough how delicious this caramel corn is. I wouldn't buy it from any other source. You can find Caramel Corn Company products for sale at Portland area Market of Choice locations, and when it gets stocked back up, maybe it'll be online again. Visit www.caramelcorncompany.com and get more information today. Remember, buying local supports small businesses and keeps your money building your community. Last but not least, Awakened Vapes has been bringing you some of the highest quality CBD vape pens since ringing in the new year of 2019. I became passionate about cannabis after a car wreck left me with major migraines, and no modern medical pills helped alleviate the symptoms. After having tried cannabis a handful of times in high school and college, it was actually a doctor's recommendation that led me to give it another try. Only then did I realize that we'd all been at least a little misled about the health benefits of this amazing plant. And despite an unexpected break because of the vape ban and then a global health crisis, the business is stronger than ever, and we invite you to check out our updated website today. We are still offering our 3 varieties with new and improved terpene formulations for enhanced flavor to go along with that custom blended terpene effect. Check back at www.awakenedvapes.com and be the first online orders of our high-demand Delta 8 cartridges coming in stock here soon. Use the coupon code PODCAST20 at checkout all this month for 20% off your entire order. That's PODCAST20 for 20% off. Welcome to Awakened Exchanges. For those in our audience who are unfamiliar with you, why don't you tell us your name and a little bit about what you do?
Hi, my name is Charlotte Ash, and I've been the director of the Snake River Community Clinic, a free nonprofit clinic in Lewiston, Idaho, for 20 years.
And how did you first get involved with Snake River?
At the time I was actually just looking for a job, and I had applied for that job and also one at the college teaching, and I managed to get both of them at the same time. I just wanted to be able to help the community. It was a job that kind of spoke to my heart, not my pocketbook. So when I was offered the job, I grabbed at it.
So you were you involved with the nonprofit sector at all before this, or was this your first foray?
I had worked with the Valley Family Youth Resource Community. I was the director for the Valley Family Youth and Resource Community Clinic. It was kind of a little business that the Valley put together for at-risk youth. So I had worked with that nonprofit before. Other than that, I had basically just worked in kind of the healthcare field administration for Spokane Nurse Care before, and then did some law for a while, corporate law, and then some private business. My husband and I had a business called Laser Search in Lewiston. It was a family laser tag business, and so it was kind of a transition after we had to close that business into just getting back into helping with the community. Like I said, at the time, I didn't need the money so much as I just wanted something that kind of satisfied my soul. So I was really glad to be able to get involved in that nonprofit.
I definitely wish more people would do things that spoke to their soul rather than the pocketbooks, but unfortunately we do all have to put a roof over our heads and such as well. It's nice that you found something that could do a little bit of both, hopefully.
Yeah, it was a lousy job to have for retirement because I had no benefits afterwards, no retirement plan or anything. But for the time I was there, I definitely felt like I was a help in the universe, which it's always was a good feeling. Good feelings don't pay the bills all the time, but it's sometimes you got to have that good feeling in order to try to just survive sometimes.
And what is the basic mission for Snake River Community Clinic? What do they try and do?
The Snake River Community Clinic has taken care of uninsured, medically needy people since it's opened in the year 2000. It was there because Idaho and the area in this region here in the inland Northwest had a lot of people who were working at jobs but didn't have jobs that had health care benefits, people who were low income and couldn't get on Medicaid because they made $1 too much. And so we just saw this great need out there for people that really needed and deserved health care and weren't able to afford it. And so that was the niche, kind of what they call bridge the gap between people who had care and had state care. So there's this pile of people out there that are hardworking people and couldn't afford to go to the doctor for anything or would go bankrupt if they did. And so we just decided that's the kind of people we need to take care of. We thought we'd see a few people, and over the last 20 years, we've helped over 11,000 people.
Wow, that's amazing. I think there are so many of us that are either uninsured or underinsured, and the large majority of the country is just kind of coming to this realization that we're not taking care of our own people at this point.
True, unfortunately, and you're right about the underinsured. We started out helping just the uninsured, but we changed within the first 3 years to underinsured also, because sometimes people had quote unquote health insurance, but it was just catastrophic care. It wouldn't kick in until they met their $5,000 deductible, which they would probably never be able to meet. So yeah, underinsured is a big thing. Just because you have health care doesn't always mean you can take advantage of it. And a lot of people would be amazed at how many people out there don't have anything or don't have anything unless they're like in the hospital with a major, crises.
And what was your role? You said you were the director?
Right. When they hired me in the summer 2000, the clinic had not been open yet. So my job at that time was to basically develop and create the clinic, get policies and procedures, get all the volunteers I needed, open up the pharmacy, just do everything required just to get it going. And then I was the director of the clinic, which meant I herded cats, otherwise known as volunteers. Took care of over 5,000 students, pre-med nursing students that would come through and get some clinical experience. Made sure that the volunteer doctors and nurse practitioners were there when they were scheduled to be there to take care of the patients on the nights we were open. Make sure the pharmacy was going, that we had the medications we needed. And I also worked as a pharmacy tech with my husband for the last 20 years. He kind of saved my butt on that. It kind of became a family clinic because I think everybody in my family that lives within 50 miles of me had to volunteer at one time or other. But it was just getting this clinic started at the first, and then making sure it survived. And part of the survival thing was writing all the grants and making sure the funding was there. So that was a huge part of my job for the last 20 years. Nonprofits, unfortunately.
Oh, go ahead.
Yeah. So I was just going to say nonprofits, unfortunately, live and die on what people will give it. And so grants and foundation grants and stuff like that, private donations, those were the lifeblood for the clinic.
Well, I was going to actually ask you about that. How did you go about finding grants and applying through there? You kind of became a specialist over the years.
Unfortunately, I became a specialist over the years. Wasn't my plan, but I had a 94% grant writing, success rate, which is pretty good. So what you do is basically you go out, start asking for private donations, like locally. That kind of leads people saying, "Oh yeah, I work for this business," and they match donations sometimes. And also researching everything from state, federal, and private foundation grants that that you meet what their mission is. A couple of the huge big ones in the last few years was like Pacific Source out of Portland, Oregon, and the Anovia Foundation out of Spokane, Washington. They were beginning to give nonprofits sustainability grants, which means you didn't have to have a specific service or specific program or specific kind of person you were helping. You just had to be a nonprofit that had success. There was a need for you. And then they, for example, Pacific Source gave us a 5-year grant that will go through the year 2021 just for operating expenses, because 99.9% of grants out in the universe will allow you to write for operating expenses. That's what they expect you to get from fundraisers and stuff, which are fundraisers are a great idea, but not great in execution because you need people to help make them, get pulled off, and volunteers to help with that. And it's a huge undertaking. Sometimes it costs nonprofits more time and energy, and sometimes even money that they will ever make out of them. So the grants were the lifeblood, and big foundations like I said, Anovia and Pacific Source were the ones that really stepped up to the plate and helped. We never had any government assistance, so the federal government and the state of Idaho and state of Washington basically don't give you state money to provide those services to the uninsured and underinsured. However, in about starting 4 years ago, the state of Idaho sexually transmitted disease program for the state came to us and said, if we gave you guys money, would you do the testing? Because at that time, the health departments didn't have funding for testing, and I'm not even sure why, but they didn't. So we started accepting state funds to do those specific services. They were grants, they were competitive grants, although they had come and asked us if we do it because nobody else wanted to. But, basically, we weren't getting state and federal funds for anything. Those specific programs like the STDs and stuff, it was kind of a fluke. It's just because for some reason the state would not give the money to the health departments, which should have been doing the testing. Still not sure what that was all about, but we were more than happy to help because we knew there was a big gap again in that kind of a service, and low-income people couldn't afford to go get an STD test, and yet they're probably the people who are some of them, not all of them, but some of them are a little less educated in sexual education, or just don't quite get that you need to use protection all the time. And some of those guys are the ones that were like making the disease go around in circles. So we knew that there was a need there, and we just said, yeah, you guys want to give us money, we're more than happy to provide this service.
So that's the first state funding, and probably the one topic that the state health boards didn't want to talk about, but they came to you for anyway.
Right, exactly. Yeah, like don't tell anybody, but yeah, I still just kind of like my eyes are blinking, going, what? Why aren't the health departments doing this? But it's just sometimes all it comes down to, unfortunately, is politics. Is because these guys over here don't believe in sexual education or sexual transmitted disease prevention because you're also supposed to have sex after marriage and stuff like that. So those unrealistic views just kind of really clash with reality, and they've got to find some way around it. And we were the way around it, which I was fine with.
I was going to say, no offense, but when I think of Idaho and sex education, my guess is it's still very abstinence based.
Oh my God. Idaho has some really beautiful mountains, John.
Yes.
But when it comes to legislators, we're just waiting for this whole bunch of them to finally either give up or die because, healthcare is going nowhere fast with them. They've got what they need, and they think that means everybody else has got what they need to do. So.
Well, we saw, Trump was able to beat it in just a few days, just goes to the best hospital with the best health care and everything's fine, right? No virus.
Yeah, it must be nice, huh? Yeah. Don't let it get you down because you too can not get what I get because I'm the really rich guy in the state. So, yeah, unfortunately.
So how do people find their way into your clinic most often?
Well, most often they most often it's word of mouth. We don't even advertise, haven't advertised for several years because we are always full by word of mouth. One person found us and told everybody in the family and their friends, et cetera, so people come in that way. We have had a lot of people referred to us by doctor's offices or urgent care saying, hey, this is really not an emergency. You need ongoing care. You can't afford it. You don't have Medicaid. Go to the Snake River Community Clinic because they're there for you. And we're, a full-fledged clinic. We meant to be, when we first opened, what they call an acute care clinic. We were just going to see you tonight for what you needed tonight, and, come back later if you get a sore throat again. We ended up being people's primary care provider within a year. So taking care of chronic illnesses like diabetes and hypertension, everything up to, heart disease, because people haven't managed to get, the healthcare into the healthcare system yet. So it's mostly word of mouth. There have been occasions when some of our grantors require us to put something in the newspaper saying, hey, these guys gave us some money, isn't that wonderful? And then all of a sudden, we've got a big giant influx of people again. Oh yeah, you guys, you're there still. So, but they find us. They can find us on Facebook now. We have our website, but it's mostly just, people in the area telling somebody else in the area about the clinic, and they realize, oh yeah, thank God there's something there to help us.
So you guys are already, like you said, full just from word of mouth, so you can't really take on a lot of new clients where you did try and advertise and even get out there and fundraise. We never turn anybody away. Sometimes we get overwhelmed. We do have night clinics and day clinics. So when we first opened, we were only open 2 nights a week. So our volunteer doctors and nurse practitioners, and our volunteer pharmacists, and our volunteer nurses, and our volunteer lay people would come, and we would start clinic at 6 o'clock. And for the first 3 years, we were there until 10:30 or 11 o'clock at night to make sure we had seen everybody. Wow.
So we never turn anybody away. About 5 years ago, we realized that the 2-night clinics just weren't going to do it. So we opened up our 2 nights, we kept those going. Plus we opened 2 daytime clinics, and they were full. But we find a way. People might have to wait a week for care if they're not like having an urgent problem right now, or they're going to sit in that waiting room for a couple of hours waiting for their turn, but they will get seen.
That's very impressive. What's the best way that someone can actually help you guys at this point?
Well, the biggest needs the clinic has always had is money, of course, but also professional volunteers. So doctors and nurse practitioners, PAs, physicians assistants, those are the kind of people we need to step up. When we first opened in the year 2000, we had 32 of those provider specialists going through our calendar, so people only had to volunteer once or twice a year.
Wow.
And then it whittled down to 8. Then it went back up to 12. But those people have been with the clinic since we opened, and some of them are retiring. So there's that need for just literally volunteer professional medical providers to come in and to volunteer.
Now, were they coming over a lot from the college across the river, or where are the volunteers? Where would you think the volunteers would be likely to come in from?
Well, the professional volunteers are mostly coming from most of them are coming from one of the private clinics in town here, Valley Medical Center. They make up about 80% of our volunteer providers. We have had a couple of volunteer providers coming in from across the river because we're right on the Snake River, where there's Washington-Idaho border. So they come in from tri-state clinics and stuff. The nursing volunteers are mostly nursing students from Walla Walla Community College School of Nursing or Lewis Clark State College School of Nursing. We have lots of med and pre-med students coming in from the University of Idaho. The med students are from the University of Washington Medical School that has a spot at University of Idaho in Moscow, Idaho now. So they come in, and at a certain point, like third-year students can literally see patients on their own and kind of prescribe medications and stuff. They just have to have it signed off by a regular doctor. So those kind of people help clear the way that we aren't totally reliant on the medical professionals that come in. We can do it with, one night we could do it with medical students and one doctor instead of 2 doctors. So they're coming from most of the private sectors and the school sectors. Yeah. We have had some school faculty come and volunteer to not only help us see patients, but also watch their students while they're there. So they're kind of doing two for one thing. But yeah, I mean, they're from both Washington, Idaho, and out-of-state students that are, having to have this clinical experience and stuff, that they've really depended on our free clinic to help them provide that while they're helping us take care of those patients.
Is there a time of year that your services end up getting used more often?
Well, we're kind of busy all the time, but I have to admit that the late fall and winter do get busier because people are indoors together more, and this is even pre-COVID-19. People are together closer. They're going to give each other more stuff, so you get sore throats and the flu and colds and stuff. But people come in, it's really an educational experience sometimes for the patient because they want to come in. I've had a stuffy nose for 2 days. We're going, really? Because it's like, this guy's had a stuffy nose for 14 years, and he's just now coming in. But I mean, we can't cure the cold. Sorry, it's a virus. We can't do that. The flu, so we're kind of educating the patients that what to watch out for. That really is something important, and what you can just stay home and blow your nose for. We have had patients that have come in for just what they thought was a little nagging thing that just wouldn't go away, and it turned out to be cancer or something horrible. So sometimes they come back for every little thing just because they're afraid it's going to be something big again. But usually it's the, late fall, winter time when the flu is going around. With COVID, we've started doing a lot of telehealth, so people can stay home and they don't have to come in. That protects our volunteers and our staff and the patients more. I was a little concerned when that kind of happened to us the end of March of this year. What are we going to do now? And the person that's taken over my job as the new director said, well, let's try telehealth. I'm thinking, fine, you can put it together. We'll try it. And it worked so well. Within a week, we were seeing probably for the next 4 months after that, probably 60% of our patients were just telehealth.
Wow.
Which really opens up even more spots for more patients because you can usually get through a telehealth visit pretty quickly because people when they come in to see you in person, they tend to kind of almost do it as a social / medical hour. So they're kind of like visiting with you and you're visiting with everybody out, in the hallway and everything. And it's an extended visit and on telehealth. I think they feel a little intimidated, like they're taking somebody's time and it's on, their FaceTime kind of thing and talking to somebody over the phone or on a computer. And they tend to, for some reason, not visit as much. They just want their talking taken care of. So that's opened up some more spots.
I'm assuming that opening more spots is also fairly good with the COVID rushes coming and going. Has there been more coming in your area lately as well?
Unfortunately, Idaho has been in the red more often than not. Not as often as North Dakota and South Dakota. So, there is somebody we're still here. But in the region, we have had kind of an explosion. Part of that is because of all the colleges coming back and a lot of them having in-person classes. There are some of them, like the University of Idaho, Wazoo, Washington State University, are going back to some like online classes, which are difficult for students. I mean, I used to be a teacher. I know how hard that is for teachers. It's even harder for students to do online stuff. And some of the stuff is like, how can you do it online? That's how that explosion kind of happened when the students came back to college. There is, unfortunately, still in the region this, it's just a hoax until you get it. There's denial, which is ridiculous. I don't know how much scientific fact you have to have before you finally say, okay, it's real. COVID-19, and we don't take care of people with COVID-19 because we're not qualified to. We don't have an on-staff full-time provider that can follow your case. Yeah. So the state of Idaho and the CHADS clinics, which is a federally qualified health center that has a satellite clinic here. They're from Spokane. They are the ones that do the COVID testing for low-income people, and they'll follow your case and then help you get, if you need to get into a hospital or something like that. But we did have an explosion at first because everybody thought they had it. I have a fever. I'm scared. I'm sick. Everybody just wanted to be tested. And then unfortunately we had to, tell them, well, nobody's getting tested now because there's nothing available. And then when it became available, you had to have certain symptoms or you didn't qualify. And it's a little easier now, to get tested in the region because there's federal funds and state funds for tests now, which just happened probably within the last 2 months. State funding just happened 2 weeks ago. Wow. So, it's scary, crazy. But so all we could do is just tell people, these are the symptoms to watch out for. If you're not at this point, you can stay home and survive it. You get to the point where you can't breathe, go to the hospital because then you're in an emergency and they have to take care of you.
It's crazy to think that we were 8 months into the pandemic before they decided to open up funding for the pandemic.
Right, exactly. Right. And it's still not as open or as easily available, especially in rural areas. We're a regional free clinic, which means we take care of 3 counties in southeast Washington, 5 counties in north central Idaho, and then just anybody that's driving through, and plus all the students that might not, foreign students that might not have insurance. But we are a very rural area, and people. I mean, we have one patient that drives 139 miles one way just to get to our free clinic. Wow! And you can't do that in the wintertime. And when you're trying to get help, I mean, some of those barriers are ridiculous, and some of these people will never get to where they need to be before it's too late.
That's just crazy to think about. 2.5 hours one way, and when the roads are open to do it, just to get the health care you need to get by.
Right. It's sad. It's scary sad. And there's transportation issues are huge. Financial issues are huge. So there's all those barriers to care in our region. The telehealth has helped a little bit because people can call in, but there's in Idaho especially, what is called a digital divide, which means a lot of people, over 60% of the people that live in the state of Idaho, don't have either a computer and or access to the internet. And that's a whole lot of humans out there that don't have what things that people take. Yeah, that people take for granted daily. So they can't even reach out for help if they want help.
I think most people in major U.S. cities just assume everybody has the internet. It's just on their phone. They have it right there in front of them all day long, right?
Exactly. And even if you happen to be lucky enough to get a cell phone, because there's programs out there for low-income people. By the way, if anybody's low-income and you don't have a cell phone, there are state and federal programs that will help you get a cell phone. But in some areas, like in rural Idaho, you can have a phone, but you're not going to have service. I mean, because you're like one hill too far to the east, or you're 10 miles too far from the cell tower, or what's going on. You still don't have any way of getting out. You have to drive to a point where you're on the right corner at the right time and leaning to the left so you can have cell phone service.
Yeah, it's just crazy to think about. I know they've been talking, I can't remember if it's SpaceX that's putting satellites up there to try and beam down internet to us instead, seeing if it can get over that. Yeah. I just don't know. Yep. Don't know what the solutions are on that yet.
I don't think anybody does for sure, but I can tell you one thing: science is going to save us, not other things. I mean, it's kind of like magic, except for it's real.
Oh, what's that? I think it's Arthur C. Clarke that had the magic is just any technology so far advanced is just like magic, something along those lines. Yeah.
It's just let it be magic, but it's still real and it's still science.
So, what's the biggest challenge you've had to overcome in the last year, and how have you guys done that?
I think the biggest challenge has been COVID, just because it really threw everybody for a loop, including funders. They weren't sure, we've given you money to see patients. Now you can't see patients. Do we take your money back? So there was a whole lot of that for a while. That was kind of scary. And then the good thing is, like, big foundations like Anovia and Pacific Source, and I don't mean to keep bringing those two up, but they have just been like the light at the end of the tunnel that was not a train, and saved us. But they just basically said, find a way to take care of your patients that will help you get more money to do it. So when we did the telehealth, that was, because it's, you have to make sure that the system you're using is HIPAA regulated. You have to make sure patients' privacy is protected and everything. So some of those things did cost us to get started, and they were right behind us saying, hey, it costs you $1,000 here, here's $1,000, just make it happen. Just kind of having to come up with a new plan after, just about 20 years of, hey, this has worked really well this way, let's not screw it up. And then, then that walked in the door. And also a lack of volunteers. There's a lot fewer people in the last few years that really want to come out and volunteer and help other people. We've even asked some people that were close to us, hey, would you like to volunteer at the clinic, just, maybe one night a month or something? And we've got responses from, I don't have time, I'm afraid to be there because somebody will make me sick, to, well, nobody's ever done anything for me, why should I do it for them? I'm thinking, oh my God, guys, and so volunteers, a dearth of volunteers in this last year has been scary and unusual, and a little very surprising, because I just didn't quite get why people weren't volunteering anymore. But with COVID, that has affected volunteers because they're afraid of getting, not just maybe a cold or the flu, but now something that could kill them. I could understand that, but sometimes you're just not sure why the professionals aren't volunteering. I mean, maybe for the same reasons, but they've got to know we still need help.
It kind of worries me if it's just apathy as well. You were saying There's some aging population with the workers in the area. Do you think that's also with the rural nature? There's just less youth coming into it?
Yeah, there is. It's difficult. It's always been difficult to get new people, new blood into the region, just because there's nothing really to bring them in unless they love to hike in the mountains or fish in our rivers. There's not concerts here, there's not orchestras here, there's not ballet here, so it's really hard to get people who might want some of those things they can do with their money after they're done working all day. And I think nationally, it's been difficult for people to find something that really incentivizes people. Doing it for your heart and soul isn't as big a thing as it used to be. It used to be like huge. And now I don't know. I think you're right. I think there's either some apathy or there's a whole lot more people looking more inward than outward. So maybe it's not just apathy. It's like, I got to take care of myself, right now. So, but yeah, the aging population, we're losing providers left and right because they're either dying or they're retiring after, they're 80 years old and finally gave up. And it just is happening.
So Spokane's the nearest large city, is that right?
Yeah.
And that's pretty much Gonzaga. What else is there that draws youth besides Gonzaga at this point?
So, Spokane has a symphony. Spokane has Broadway shows. I think there's 6 or 7 a year. And they do have some things like shopping and things that, far outweighs anything you get here locally. And of course, if you go another 3 hours west to any place else, it's even better than Spokane. Spokane's our draw. Basically, Gonzaga, if you're a sports fiend, please God, come here because, 2 hours away, you can go to some of the best basketball games you can ever see. I think part of the draws, thank heavens for University of Washington, has been their expansion into Spokane and Moscow, Idaho, of their medical program. So now more rural students have a chance to actually pursue those degrees and those things because they're not having to, move to Seattle or move to Portland or move something huge far, far away.
So if they're already making that move for school, they're likely to stay that direction, I would assume.
Right, exactly. And that's what UW has kind of come up with it. Like if we put a medical school in your region, those people are more likely to be from your region and want to stay in your region. And I think it's going to work, but we're looking at like 2 to 5 years now for some of those students to become the providers that we need that are willing to stay in the region and not necessarily big bucks, but they know the people that they're taking care of, and it makes a difference to them because they do know them.
Well, this is, and I've probably mentioned it a couple times on the podcast, but I tend to be a believer in a universal basic income kind of situation where people can not have to worry about their medical needs, their food, their shelter, and just having those basics. It doesn't have to be a large sum, but some sort of basic security. And when you have providers like that who now know, okay, I'm not going to struggle here, but now I can actually provide support for these people that I care about. I can stay in this area. I can do my things here. It has to become more about the people than the money.
Absolutely. And I totally agree with you. I think universal basic income is Christian. If somebody is Christian, you guys want to hear that, you want to be a Christian, let people have the same, a chance. It's humanitarian. It's, just basic good human decency. Not everybody that's poor is poor because they made bad decisions. And it's like if you're homeless or hungry or poor and you've got something you can help those people with, give it to them. It doesn't, so what if they screwed up their life or they were doing well and now they're not? That's not the point. The point is to care for them, to give them the care, to build a longer table, not a higher wall.
I like that. And do you think that there's a fair amount of youth that wants to stay in there if they weren't drawn to the big cities?
Oh, yeah, absolutely. With the new University of Washington School of Medicine at the University of Idaho in Moscow, Idaho, which is just north of us about half an hour, when that opened up, there was a plethora of students who wanted to go to medical school but weren't sure how to do it so far away from family. There was a good number of students who said, if I go to school here, I can stay here. So there was that kind of awakening in a way, like, yeah, maybe this is going to work, and I can not have to move away from my family and my community. I can stay and help. So that's happened in about the last couple of years, which is very, it's very good for my heart and my soul, and professionally, medically, it's good to know that those people are making those informed, decisions, that helping family and staying in their community is a good thing again. That hasn't been the case for a long time. A lot of students said, I'm getting out of here as fast as I can. I can't survive here. There's nothing for me to do here. It's just, it's nice to see that sense of community come back with those younger people. And I think that's going to make a difference. But again, we're like a couple of years out before they're going to be the doctors and, not just the residents, but hopefully that's going to be the savior of everybody eventually.
So that's looking 10 years ahead, where we have some promising future out there. What would you have liked to have known 10 years ago that could have helped?
I think 10 years ago, I would like to have known that I would like to, maybe not me to have known this, but like the universities to know that it's like build the dreams. If you build it, they will come.
That's exactly the thought that was going through my head as soon as you said, if you build.
Yeah, exactly. I wish that thought would have happened sooner, professionally, from the people that had the money and the capacity to put that out there. Something I would have wanted to know 10 years ago is, doing something for your heart and soul doesn't necessarily pay the bills. Still not look at that way at 10 years ago, what that should have been.
Well, I'm sure there are many people who are glad that you didn't look at it that way and that you just continued to help and do everything you could for that last decade.
Well, I can tell you, I don't know if they're glad, but I haven't killed anybody.
Haven't gone postal yet.
Not yet.
So before we transition to something off of the healthcare topic, is there anything that I should have asked but I didn't think to?
I don't think so. I think the only other parts of healthcare conversations are so politically charged and so dependent on what the next guys are going to be doing. It's kind of useless to talk about it right now.
You have any personal opinions you want to share on that?
Yeah, Republicans suck. Most people say that out loud. No, I think so. My official response is wear a mask, stay safe, believe in science, and just do the right thing, because it's not just for you; it's for other people too.
One of the things I try and remind people of is it doesn't matter what religion you're in, there is some form of do unto others in every single one of them. So if we were doing right by others and helping them succeed where they need to, then we would start putting into place those policies that will help the less fortunate, not just those who have already made it.
That's true. Absolutely.
So, like I said, we're getting a little bit farther into it, and I like to try and do something about exploring your passions. And while helping people has definitely been that passion and that main drive for you for a long time, is there anything else that you geek out on, for lack of a better term?
I haven't geeked out for a long time, John. I haven't had any time to do that. I realized coming into retirement, I haven't read a book for so many years. I was thinking, man, am I allowed to do that? I'm playing a lot of crazy arcade games on the computer, like, shoot the aliens, and my grandkids are going, "What are you doing, Grandma?" Like taking out, I'm just kind of like getting rid of some of the stress. I love traveling. We have a cabin in Northeast Oregon down at Willow Lake, and just being there and, vegging and napping has become one of my favorite pastimes. So, when all this stuff is over and people are allowed to go and do things again, I love seeing the USA. My husband, Dwayne, has taken me from here to the other side of the United States and back again on a motorcycle. And it would be nice to be able to do that again.
Absolutely. Any favorite stops along the way?
Oh, yeah. We have seen some beautiful country. I think I can easily say for both of us, one of our favorite places to go are all the canyons in southern Utah. Just fantastic place. One of our favorite places to go is Kanab, Utah, because it's right above the Utah-Arizona border, so we can go to the north rim of the Grand Canyon and Bryce Canyon and Zion and all those beautiful places, and you can, be on your motorcycle and you can see absolutely everything. Yellowstone is beautiful if you can avoid all of the tourists, which means go really at the end or the beginning of the season. There's some incredible places. I mean, we did in North Carolina. It's funny being from the Pacific Northwest. You hear all these people talking about the Blue Mountains and how fantastic it is in the east. And you go back there and you're going, where's the mountain? And you're driving on a waterfall that is maybe 100 foot tall. And you're going, hey, what about Multnomah? So it's a little hard to be this side of the Rockies and get what they're saying, but it's still beautiful country.
When I lived in North Carolina, I very much remember the hills and realizing that that's what they were calling the mountains. And go ahead.
We were on a motorcycle ride with a group in Texas, and they called it the hill country, and we're kind of giggling to ourselves like, we're the hills. And we kind of went up a slight incline, and it literally had a sign saying hill. And we were laughing because, it was so bad they had to tell you that's what it was.
It's not quite flat, so this is what we call our hill.
Exactly.
I actually had a friend come back from the East Coast, and they had never seen a real mountain. So we had a semi-clear day where you could see Mount St. Helens, Mount Adams, and what's the third one over here? Mount Hood.
Mount Hood?
Yep, all on the same day. And it was just like, those are the mountains.
Yeah. We have friends that come, and we are just west and slightly north of two of the best motorcycle roads in the U.S., Lolo Pass and Rattlesnake Grade. I mean, they literally are on American Motorcycle Association's best roads, to travel. And we have had friends and family from like Indiana and the very flat Midwest come and freak out because they're going down such a steep hill. And just outside of Lewiston, just over here between here and Spokane is Lewiston Hill. It's a hill to us, but there are literally semi-truck drivers that call and have people who live here come up to there and drive their trucks to the bottom of the hill because it's so steep. Because they're from, Nebraska.
Yeah, I was going to say. I used to make the trip from Portland to Bend, about once a week or so, and I had to chain up a couple of times, but short of that, I mean, it's just, it's not something that I think of as a treacherous trip even, and then I just start thinking about people who have never driven that before, and you're like, oh, okay, gotcha.
Yeah, exactly.
Are there any places that you're really looking forward to going to?
Well, my husband and I actually had a planned trip to take a train to Washington, D.C., and then see all that kind of wonderful things over there. That got canceled because of COVID. So that would be cool. I've been to D.C., but I was ill at the time, so I didn't get out and run around to all the different places. I wouldn't mind going back there and going through all the Smithsonian's. He's going to eventually take me motorcycle trip through the Keys in Florida, or so we think, before we die. Love to go to the Sedona, Arizona area. I've heard a lot about. I've lived in Arizona, but I don't remember seeing that part, so I would like to go there. And you know what? We could spend probably the rest of our lives just going around Idaho and Washington and the Pacific Northwest and seeing all the incredible places that are around here. I've lived all over the United States, literally all over the United States. And I have to tell you that the Pacific Northwest is probably the most beautiful part of the United States I've been in. I mean, it's got everything. It's got, deserts in the middle. It's got mountains and oceans. And it's an incredible part of the United States.
It really is. And we forget that, our country is so huge that these states are like country divisions in a lot of Europe,
Yeah, absolutely. Right, exactly. I mean, when you're back east, you go through like Kentucky or in Tennessee, and you're like in a new county every 5 minutes. And over in Europe, when I went over to France, and then you go to, you go an hour and you're in another freaking country. So it's just weird. But yeah, I don't think people realize. Sometimes I think we get so wound up in our personal stuff and our political stuff, especially the last few years, and we forget how huge and wonderful this country really is.
Well, I really hope that you guys get to take that trip back to DC and enjoy those museums among everything else. I went as a kid, and I have a lot of fleeting memories, but it's definitely something I want to go back to as an adult myself.
Yeah, absolutely.
So,
a lot of history.
Yes. And I suppose that's going to take us towards the moment of vulnerability section that I like to talk about in here. And hopefully I don't ask anything too personal for you, but the first one is, what motivates you in life?
Right now, what motivates me in life is my family, making sure that they're okay and taken care of. Money motivates me, but I haven't had it for so long, so it's like no. So yeah, really, what motivates me in life is my family, my love for my family.
And is all your family fairly local?
Well, I have 2 stepsons and 2 sons and 8 grandkids, and most of them are within 100 miles of us. I have 5 siblings that live over on the west side of Washington, so I don't get to see them very often, but I love them. And I get nieces and nephews, but I don't get to see some of my extended family, but my immediate family, we usually see them at least once a month. I have one son who actually literally with his family lives a block away.
Wow.
Which is kind of nice, unusual. So my granddaughter's over here quite a bit. She's teaching me how to play Minecraft and Roblox.
I have heard of both of those. Never played either one yet. So
never.
So with them being local, I assume that that's pretty much where you want to be, minus the traveling. Is that where you plan on staying through retirement then?
Yeah. I most importantly, I couldn't get my husband to leave if I wanted to. He's been here forever. He's cemented into the region. I have to admit, the first time I came to Lewiston was on a 110-degree day, and I said, no way in hell would I ever come back to this place again. And I've been living here for 26 years now. So,
congratulations.
What you see. Yeah, thank you. I'm here for the duration.
Well, then, what scares you in life?
The things that scare me in life the most are people who think they're Christian and really have no freaking clue what that is supposed to mean. They seem to be some of the most judgmental, unkind, small-minded people I've met in the last 10 years, which is sad. But they scare me because they think they're right and they'll take anybody down trying to prove it.
Do you see that Christian label as something that tends to be church-specific instead of all Christianity? I guess that's what I've noticed. Is it's not just all Christians, it's this church's Christianity is better than that church's Christianity.
Yeah, I know. There's like some story that says basically if you believe in one religion, you're going to go to hell because every other religion said if you don't believe in theirs, you're going to go to hell. So you can never win. But yes, there are some churches that really, pound that giant, I'm a Christian and we do Christian stuff. And they're like teaching the worst, horrible, racist, terrorist kind of things to people I've ever seen. So I think Christianity has been bandied about too much that it's lost its true meaning. Like the Catholic Church, Catholic means universal, but it doesn't seem very universal anymore. Christian was kind of based on the life of Jesus Christ, who loved everybody, and that doesn't seem to be that true anymore. So I think people have lost what it's supposed to mean, and they think that their version is the only version, and if you don't believe in their version, the hell with you, basically, literally. So,
do you have any suggestions that you would like to tell any of those people? Anything that you would hope might change their mind?
Yeah, for the white guys who think they're better than everybody else because they're Christian white guys, don't forget Jesus wasn't white.
What?
I know. And then for all of these guys who said, we hate you because you're not our religion, you got to remember religion is man-made. I grew up Catholic and I had a lot of respect for it, believe in God, etc. I cannot stand religion because it's man-made and it's mistaken. They've blown it out of, religion has just become a weapon and not a salvation anymore. And so, yeah, I think that my message to Christians is be one before you brag about it. I believe people's actions more than their words. And if you have to go around telling people you're a Christian, it's probably because we can't figure it out for ourselves.
It should not be a tool used to control people or to give you an excuse to treat people badly.
Absolutely. It's supposed to be exactly the opposite. It's supposed to be your tool to go out and see the world, create peace, and love your fellow man. And that's not just the fellow man that you like, but everybody. It's
supposed to remind us that everybody is connected and everybody has those same feelings. Exactly. And it would be nice to see that actually permeate the world once in a while instead of falling beside the religious dogma.
It would be a nice change of pace, wouldn't it? Be a nice a breath of fresh air. So
absolutely,
anything's possible, John. Anything's possible.
We could see it in our lifetimes. It could happen, right?
Sure.
I'm trying to be positive here.
I'm trying to be positive too. Maybe we'll both be surprised.
There you go. So, on the positive streak, why don't you tell me one of your happiest moments in life?
Wow. One of my happiest moments in life. Professionally, it came from a woman who came in who had a lump in her breast for 4 months and was afraid to go and find out what it was for 2 reasons. She was afraid she would find out it was terminal and she was going to die and somebody was going to tell her that. She was also afraid to go to the doctor because she knew she couldn't afford it. She thought she'd lose everything she worked her whole life for because of an illness. It turned out to be stage 2 breast cancer, and we got her connected with a surgeon and got her care within a week, and she had surgery and it was had chemo and everything like that. And having come to our free clinic because it was free became her freedom to have health care, and it didn't cost her a penny, and she's still alive today 4 years later. So that was a happy moment.
Wow.
Personally, my happy moment is I had kind of an abusive relationship for several years before I met my husband, Dwayne. I met him just on a fluke because I turned 40, my mom died, and I was sad, and I wanted to get out of town, and he was going back east and needed a traveling companion just to help with money. And within 2 days, we were the best of friends because I had spoken to him more in 2 days than I had spoken to another human being socially for 10 years before that.
Wow.
We fell in love, and I've been happily married for 25 years. Don't tell him that because he's a big head. But that brought me a family. My son back into my family. I had been without them for a couple of years. So that was the happiest moment of my life when I found out that somebody cared about me and my kids and that we'd be part of a family again.
It's beautiful. I'm really glad to hear that that has happened. And you guys have been together for how long now?
25 freaking years.
Wow. All right.
I know.
Man. So let's see. Yeah, that's actually a fairly big year. I think that was the year my parents got married as well.
Yeah, I think so. So, yeah, happiness is a wonderful form of revenge.
I like that. I want to use that one. Happiness is the best form of revenge. I like that.
Yep, it is.
So, getting down to the last couple of questions. How would you like to be remembered?
Oh, man, I was just thinking of that recently. On my tombstone, I would like it to read, "She was loved and she loved."
I think that you have accomplished both of those over the last couple of decades for sure. Do you have any personal philosophy on life?
Yeah, you better live it now because if you save up, it might not be there.
I like it. Any last words or anything? Any shout outs?
I guess I do want to shout out. So a couple of them. First of all, my husband, Dwayne, who probably won't hear this podcast because he doesn't know what podcasts are. I love you. And my sister, Loretta, she's been a very dear friend and very close, probably closest family member other than my brother, Jim. I love you in spite of yourself, kid. To you, John, because I'm very proud to know you, and I really hope that this is a super success because you're very good at what you do. And to the universe, be nice to each other.
I think that's a very great way to end. Thank you very much for sharing your time with us today. I've been very glad to have you on here. Thank you again for listening, and I hope you enjoyed this conversation as much as I did. I want to give a special thanks to all of our listeners. You are the reason I'm doing this. Please tell your friends about us, subscribe to us on YouTube, Spotify, or wherever you're listening, and please leave us a 5-star review on Apple Podcasts. Every podcast says that because it really does help spread the word and visibility. You can also support us on Patreon or connect with us on the social media of your choice. We are at Awakened Exchanges on Facebook and Instagram, and at Awaken Exchanges on Twitter. Thanks again, and have a blessed day.